maybe we'll go ahead and get started. Let me very quickly introduce Kathy Newsel, Dr. Kathy Newsel, who is the Fogarty director, the director of the Fogarty International Center here at the NIH. He's going to get us started with some opening remarks.
Okay, thank you, Susan. Welcome, everyone. I am the director of the Fogarty International Center. I assumed this position in May, and I understand we have a broad representation here from the research community, and so sincere welcome to all of you. Many of you may know that the Fogarty International Center is dedicated to advancing the NIH mission by supporting and facilitating global health research, building partnerships, and training the next generation of scientists. So I think this research and training model that's built on strong US and LMIC partnerships is consistent with the theme of this webinar. So again, really pleased to be kicking off this webinar on global food and nutrition insecurity across borders. And there have been increasing investments in tackling food and nutrition insecurity across the US government and the NIH specifically. And in 2022, the White House Conference on Food, Nutrition, and Hunger emphasized the government's commitment to addressing this area across US government agencies, and importantly, the role that research plays. At NIH, we've put together workshops, we've developed relevant funding announcements, put out a notice of special interest to address stimulating research to understand and address hunger, food, and nutrition insecurity, all under the guise of the 2020 to 2030 strategic plan for NIH nutrition research. Now, in 2022, Fogarty hosted a three-part webinar series seeking to build on these efforts by highlighting innovative research projects on nutrition and food insecurity and health outcomes in global settings, and identifying lessons learned. This led to a 15-article supplement in Frontiers, and I know Susan will say more later about this supplement. So before turning it over to Susan and getting us started, I do want to thank today's session speakers, Dr. Rafael Perez Escamilla and Amos Lar. As well, this work was made possible through partnership with several NIH offices and institutes, including our Office of Disease Prevention, Office of Nutrition Research, the National Cancer Institute, the National Heart, Lung, and Blood Institute, the National Institute of Child Health and Human Development, as well as the U.S. Agency for International Development and the Centers for Disease Control and Prevention. So I am looking forward to this webinar. Welcome again, and Susan, back over to you.
Thank you so much, Dr. Newsel. I'm really excited to have everybody here today. This webinar is really a capstone of work that we've been doing here at the Center for Global Health Studies over the last 2 years. And so it's really exciting to kind of see it coming together. Aisha, can you pull up my slides, please? So our work really started with a webinar series. Next slide, please. That I worked on with partners across the NIH and the US government that highlights the robust research on food insecurity in global settings, and really thinking about the opportunity to learn about effective strategies and innovative interventions across the globe and consider the implications for US and other contexts. So the webinar series took place bi-weekly in October 2022, really building on that White House Conference on Hunger that Dr. Newsel just mentioned. So the first one provided an overview of food and nutrition insecurity, the sort of conceptual models that identify the impacts of food insecurity across the world in various age groups and settings, including the connection to chronic and infectious diseases and child development. The second one looked at the role that home, neighborhood, and community food environments play in food security, and also provided examples of effective food environment and food systems interventions across different regions that have addressed equity, access, disparities, and sustainability. And then the third one explored the role of implementation science methods and approaches used in food and nutrition and security research, and provided examples of global food and security innovation that has been adapted across settings. Uh, these these webinars were recorded and are available online on our website if you're interested in seeing them. Next slide, please. So that series led to a journal supplement in Frontiers. This was guest edited by Drs. Rafael Perez Escamilla, Almost Lars, and myself, and was completed just a couple of months ago in October. The objective was to provide an overview of the evidence in global food insecurity, really explore areas of adaptation and opportunity for translation across settings, and identify priority research gaps specific to vulnerable communities. So we ended up with 15 articles that cut across a number of topic areas, as you can see here. It also highlighted ways that we can better share results, including the importance of establishing research networks and other knowledge sharing platforms to disseminate successful strategies, and also mapping out global agreed upon definitions, frameworks, and indicators of food and nutrition insecurity. It identifies opportunities for implementation of effective policies and programs, and spotlights food insecurity research gaps, including shocks to the food insecurity that we know are coming. Next slide. So today's webinar is intended to highlight the learning from that supplement. So we'll start with a presentation by Dr. Almost Lars from the University of Ghana on understanding the food environment across the life course. Then we'll have a talk on innovative approaches and really thinking about those lessons learned across borders. This will be led by Dr. Rafael Perez Escamilla from Yale University. And then I invite Dr. Patrick Webb from USAID, Dr. Bill Gates from George Washington University, and Dr. Cecilia Tamari from Johns Hopkins University to really reflect on the topic before opening up to the audience for any of the questions that you all have. As you have questions, please include them in the Q&A box. I see the first question, and I will be providing links to the webinars and the articles in just a moment. So without further ado, let me turn it over to Dr. Almost Lars to kick us off. Thank you so much.
Thank you. Thank you very much, Susan, for setting the stage for me. So my presentation would focus on how our understanding of food environments across the life course can help us address these challenge of food and nutrition insecurity. And I'm going to be doing this using lessons that we have learned from the 15 papers that Susan just referred to. As far as today's presentation is concerned, I do not have any conflicts of interest to disclose, but I would like to mention that I'm involved in several initiatives that seek to improve our food environment, but I do see those as a confluence of interest, not necessarily a conflict of interest. I'd like to begin with a picture, and that which you are seeing here is a picture. Try to see it as a picture. Imagine a world where every child, every adult has access to nutritious food, healthy food that are tailored to their need. And this is produced and consumed within planetary boundaries. That is the world that we all aspire to be in, and it's a journey. As we journey into that, destination, we see a lot of falling heroes, bruised and scarred by food and nutrition insecurity, and there are many. If we look at data from the SOPHI report over the last 3 years, they have always indicated there are over 3 billion people on Earth who are unable to afford a healthy diet. No one unable to afford a healthy diet is food secure. And so, to a large extent, these inability leading to food and nutrition insecurity are influenced by the environment where we live, but even more profoundly by our food environment. And so understanding the interfacing impact of food environment on what we eat, or better still, what we do not eat. In other words, understanding why what is available is important in our bid to address the problem of food and nutrition insecurity across the globe. But since my presentation is going to focus on connecting the dots between food environment and food insecurity, I would like to take a minute or two to reiterate this concept of food environment. I have been able to trace its usage up to the 1960s and 80s, and it was then used within the context of ecology and systems thinking. There are papers in the late 1990s and 2000s making use of these concepts and was used synonymously with what we refer to today as obesogenic environment or nutrition environment. This definition in 2013 by Boyd Simberg and colleagues has multiple dimensions. So fiscal dimensions of food environment, economic dimension, policy dimension, sociocultural, but also opportunities and conditions. And these are the things that determine what you and I choose to eat. Indeed, that is if we have an opportunity or agency to choose. And so currently, as I speak, there are multiple definitional perspectives of food environment. But the good news is we do not have definitional disagreement. And so it is possible to consolidate all these perspectives into that which I have just put here. That food environment refers to the spaces or interfaces, whether they be physical or metaphoric, where food systems actors engage with the food system and make decisions about what to eat, where to source it, with whom to eat, and then when to eat. In 2020, having had food systems researchers almost engage exclusively on what we refer to as the built food environment, Downs and colleagues noted that if we are truly interested in not leaving anyone behind, we should also be interested in rural food environment, natural food environment. So today we talk about cultivated food environment or wild food environment. But given the age in which we find ourselves, we can't talk about food environment without talking about digital food environment, where digital actors perform digital activities in digital settings. And so that is the concept of food environment. The question, however, is how is our understanding of this concept helping us address the problem of food and nutrition insecurity? There are so many ways to respond to that question, right? But this is one. If we agree that we cannot have food and nutrition, security in food environment littered with food deserts, with food swarms, with food mirages, then it is easy to understand how understanding of food environment can help address food and nutrition insecurity challenges. Food environment interventions seek to eliminate those food deserts, food swarms, food mirages, and replace them with food oases or food havens. And so that is where I am coming from, and that is where this talk is coming from. But it is not based on that which I have done as a researcher. It's going to be based on the papers that are included in this special issue. And so beginning with the paper by Raphael, I think he makes it even easier for us to understand these connections, where he traces the history, but also the definitions of the construct or frameworks of food and nutrition, security. He noted, and I quote here, that food security is not only about availability of food. It also has to do with accessibility, utilization, and stability. But indeed, lately, others have argued that we need to be concerned about agency and sustainability as well. And so the 15 papers that are included in this special issue have dealt excellently with these multiple dimensions of food security, but also food environment. I'm looking at my watch, not a lot of time, and so I'm going to skip this. But let's begin with the learnings or insights from these papers. We are looking at life course, right? So life stages. I'm beginning with early life, breastfeeding. And Cecilia's paper, as we just mentioned, one of the really interesting papers from this special issue focuses on first food, breastfeeding. And I have added here, I see the environment within which breastfeeding is done as the first food environment. Breastfeeding epitomizes an intimate food environment, right, where mothers and infants interact with the sociocultural, policy, but also economic systems. And as Cecilia noted, we need supportive breastfeeding environment to be able to reduce food insecurity among infants. And breastfeeding environment, I argue here, are food environments. We can say a little bit more here. Julie's paper, Julie Smith and colleagues, highlight the substantial economic value of breastfeeding within the household food environment or systems. They note, and I quote here, that we need to recognize the economic value of human milk. And once we do that, that can inform policies and then support breastfeeding as a critical component of food, security. I move on to childhood and adolescence. Schroeder's paper re-narrates the challenges that adolescents face accessing healthy food within school food environment. And they note the need for us to address this in all environments where adolescents, find themselves. We can move on to youth. This paper focusing on US youth, explores the complex relationship between food insecurity and obesity. And a lot of the time when we talk about obesity, we talk about, ultra-processed food. We focus on the impact of ultra-processed food just on obesity. But that unhealthy food environment that is availing ultra-processed food, of course, impact on obesity, but it also impact on food insecurity and therefore stunting and undernutrition. And so we need to recognize this complexity in the interventions that we deploy to address, food and nutrition security challenges. We can move on to adulthood, women. Isabel Mezzarella and colleagues examine how, women's participation in agriculture decision impact household food security in Tanzania. They argue that there's a need for women to be empowered. And when that is done in agriculture, it creates, food environment that are supportive of diversity and nutrition. There are other publications focusing on food security from Ethiopia as well, but I'm running out of time. And so from these 15 papers, there are also other, determinants of food and nutrition, security that are cross-cutting determinants here. So economic factors, health dimensions. Economic factors, for example, I think this paper from Boston looked at adverse economic events on hunger severity. Osebonsu looked at nearly 190,000 surveys, right, among school-age children, and found how, food insecurity impact, sleep and therefore overall health. I would leave this because Raphael will be talking about this food as medicine, food is medicine, but also Days and Fanzo's paper, the picture that I started painting, where we are not only just producing and consuming, but we are doing that within planetary boundaries. Their paper addresses this squarely, where they looked at agri-food sector contribution, US agri-food sector contribution on, human, but also planetary health. And so overall, you would agree with me, these 15 papers collectively provide valuable insights into how food environments, influence nutrition security across different life stages. And so some of the recommendations from the papers are that we ought to be deploying adaptive strategies to improve food environment. And once that is done, it also impacts on our bid to address food and nutrition insecurity. But remember, we ought to do that recognizing the life stages that I just presented. So life stage specific interventions are needed to enhance our food environment and address food insecurity problems. I want to thank you for listening, but congratulations to all the authors of the 15 papers that I have just summarized in my presentation. But thanks also to Fogarty International Center for leading this. So I yield now and hand over the virtual floor to Raphael. Thank you. Over.
Thank you very much for a most wonderful presentation, Amos. And I have to say that I truly join him in congratulating the authors and co-authors of all the 15 papers. This is the third opportunity that I have to work with the NIH Fogarty Center on a cross-borders collaboration initiative. And I can only tell that they're just getting better and better over time. So I hope that I can get invited back in the near future. So I will now focus my talk on solutions to the problems of food and nutrition insecurity, trying to highlight some innovative work that has been published as part of this special issue. The work, the food security definition that guided the thinking and framing of this special issue comes from the consensus definition that was reached in 1996 in Rome at the summit organized by FAO, where all the UN members, all the nation UN members agreed that food security was not only about having access to sufficient, but also to safe and nutritious foods to meet the dietary needs and food preferences to actually, for people to actually be able to lead an active and healthy life. In our supplement, we are also guided by the principle that it is not only food security, food and nutrition security are not only about having the availability, but actually about having the certainty of the access at all times by all people, and that these foods, nutritious foods, safe foods must be obtained through socially acceptable ways. We also used the framework adapted from UNICEF and Frankenberger, published a few years ago, where they acknowledge, of course, that there is a profound relationship between food security and nutrition security, but that for the organism of people to actually have nutrition security, households and people must not only have access to the food, but also to access to healthcare, housing, safe, clean water, and other basic needs. So the supplement and the great description that Amos just made about the papers in it really shows that there isn't a single magic bullet to solve the problem, the massive problem of food and nutrition insecurity, but rather that we need to follow a social ecological model approach so that at the end of the day, people in their households can actually have the access needed to the nutritious and healthy foods that are needed to have a food security. At the policy level, several of the papers that focused on economic factors highlighted the great importance that access to reasonably, well-paying jobs need to have, and also the access to sustainable agriculture and food systems, combined with policies such as the taxing of sugar-sweetened beverages, front-of-package warning labels, and predatory marketing protections, especially protections from the marketing by the ultra-processed food companies. Gender equity has to be addressed throughout the social ecological model, and especially starting with the policy level decisions, and also cash transfer programs and access to healthcare. They're all very important policies that are needed for food security to actually be attained by all households. At the community level, access to microcredits, having what Amos just beautifully described as really the food environments where healthy foods can be accessed, in addition to food fortification policies, school feeding programs, water security, and addressing gender norms and social support. All of those belong to the layer of the community level. At the family level, support from the family for all members living in it, no matter what their life course stage is, life course nutrition, education, and counseling, and again, addressing gender equity is crucial, so that at the end of the day, through the influence of all these layers of actions, there can be the nurturing home environments where people can have healthy family lives, where responsive feeding approaches can be followed with infants and young children, and where family health, both physical and mental, and as well as gender equity, can really be available to all. So in other words, equity, income / other resources, plus healthy food access, plus healthcare access, plus water security, plus other social determinants of health, plus instrumental knowledge on food preparation and so on, are all crucial for attaining food and nutrition security through multi-level approaches guided by the social ecological model. So to finalize my presentation, I am going to focus on two papers coming from the US related to the food is or food as medicine approach that actually has been gestated and germinated in the US with strong implications for improving the link between healthy food systems and access to healthcare globally. So these programs are grossly broken down into two types: the medically modified meals, which are more along the clinical end of nutrition, and I won't refer to them in my presentation, but also the so-called produce prescription programs, including food pharmacies available through healthcare systems, as well as the provision of incentives to people by healthcare providers so that they can have access to healthy foods, including fresh produce. So we have 6 projects going on with my research group in Connecticut. So what I can summarize for you is that all of them include very practical, hands-on nutrition education, plus the recommendation or the referral from a healthcare provider so that people can receive a so-called Fresh Connect card equivalent as a food prescription, so that they can actually purchase a healthy fresh produce in their communities, or they can actually go to the food pharmacy in the hospital to get them. And at the end of the day, the expected outcome is that there will be improved cardiometabolic health and nutrition outcomes as a result. So I am also running out of time, so you can take a look at this slide, but it really tries to illustrate how the mechanisms operate across the social ecological model for food as medicine initiatives, such as produce prescription programs, to end up leading to improved dietary quality and health outcomes at the end of the day. So the first study was led by Dr. Elizabeth Rhodes from Emory University. This is a very important implementation science qualitative study where she actually looked at the client experiences and satisfactions with produce prescription programs in California, emphasizing the extent to which they felt they were treated with respect and dignity. And this study was done with the goal on understanding how to identify the quality of delivery of the programs as measured by the client satisfaction. For focus group discussions were carried out with the clients of to federally qualified health centers produce prescription programs in California. The key findings was that in terms of these four themes, first of all, respectful program design, the clients felt that the provision of these EBT gift cards as financial incentives offered autonomy and privacy when purchasing produce. They also referred to respectful programming as having have program staff showing that they care about participants' health and offering timely assistance with incentives. They thought about this respectful programming as not receiving prompt responses to questions when they were having challenges using their incentives. Overall, the participants were highly satisfied with the produce prescription program, and to recommend the client experiences even more, they really wanted to increase privacy issues by educating cashiers at the points of produce of sale on what these Fresh Connect EBT cards were about. The second study that was also published in the supplement was carried out in Atlanta by Caroline Owens and colleagues, and their produce prescription program included a multi-pronged intervention that provide food insecure patients with nutrition counseling, cooking classes, and fresh food delivered bi-weekly through pickup of produce boxes. It operates within a market space to serve as a hub for nutrition and well-being for hospital patients. This is at Grady Hospital, employees, and the greater community. The market also houses a teaching kitchen that focuses on plant-based cooking and nutrition and chronic disease education. And very nicely presented the mechanisms or the components of, they broke down the components of the program that are likely to explain how, at the end of the day, programs such as this one are very likely to end up improving cardiometabolic health. And the key finding here is how multi-component and interdisciplinary and intersectoral these programs need to be. In their study, they found that there was a suboptimal initial engagement or re-engagement with the program, less than expected, and barriers to engagement identified were related to competing priorities associated with poverty, including lack of transportation, caregiver responsibilities, having many work hours, as well as physical health challenges. As a result, Grady has now piloted 2 transportation support programs in conjunction with their family food as medicine program, home delivered boxes directly from the Atlanta Community Food Bank, and car shared rides for FAM participants funded by a health plan partner. The research has really pushed the envelope for their system to think outside the box on how to help address these major social determinants of health issues so that participants can engage and benefit much more than what they were at the time of the study. So in conclusion, there is no doubt that long-term solutions, permanent solutions to food and nutrition insecurity require addressing structural determinants of health. Unhealthy, ultra-processed foods loaded are the default food systems globally. We cannot make progress without changing that, and massive poverty and social injustice are still preventing families from accessing healthy foods. In shorter-term solutions do require cross-border collaborations to further understand how to adapt successful large-scale programs from other settings, including conditional cash transfer programs, sugar-sweetened beverages, taxes, front-of-package warning labels, marketing protection, and we now know also that food as medicine or food is medicine programs that have been conceived and are thriving now in many parts of the US. Community-engaged research, such as the one included in the 2 papers that I highlighted, are needed to make produce prescription and other innovative food and nutrition security programs much more person-centered and respectful, which in turn is truly expected to increase program demand, engagement, and impact. Thank you so much for your attention.
Thank you so much, Amos and Rafa. This was absolutely excellent. And I think you did a really nice job of summarizing what was, a large 15 article supplement into one sort of very succinct thing. Seeing some questions coming in through the Q&A box, that's great. But right now, let me turn it over to Dr. Patrick Webb from USAID to reflect on what he's heard and on the topic more generally. Thank you.
Thanks, Susan, and thanks everyone for the opportunity to be here today. And Truth in Advertising, I was a co-author for the paper on women's empowerment in Tanzania, so I'm not going to touch that. More importantly, I'm the chief nutritionist for USAID, and I believe that this is a critical moment to be having this discussion. It's a critical moment for nutrition and for food security more broadly. We have new evidence every day about how concurrent economic crises, conflicts, climate change are impacting nutrition all around the globe. And these are all cross-border challenges. And one of the things I really liked most about this supplement, yes, the content, but is that it included both US-focused and non-US focused papers. And both of you, Rafa and Amos, have distilled that so much can be learned across country experiences. And so many of the challenges where I work across low and middle income countries don't respect those artificial lines on a map, the borders. They're often regional in scale, underlying causes are regional, and often they need solutions at that scale, not simply at a national and subnational level. So I was looking at it, what you were saying from that kind of perspective. So Amos, you focused on food environments. I think this is still an under-researched space in the broad food security literature. I think you did a great job distilling the papers, and you highlighted the different dimensions of this topic. The papers are a great contribution collectively, and it's a foundation on which we need to build going forward. My one question to Amos would be, while appreciating and supporting the need for diversity of definitions and approaches, which you emphasized, can we ever reach a core understanding of food environments that can be measured in one context, but in multiple contexts as well, so that we can compare across borders and we can assess trends over time? Is that something we can expect as we go forward? And should we be? Rafa, great distillation, as always. I mean, by the way, Rafa, you showed the 1996 definition, which confirms clearly there's no silver bullets here. And today, I would add that we have these two additional dimensions from 2017, the CFS high-level panel of experts, namely agency and sustainability, as the fifth and sixth dimensions of food security. And so, Rafa, you asked to be invited back again, and I agree that this supplement is not the last word on these issues. We have more to do, and we have to concretize what agency and sustainability mean in the context, the complex context that you mentioned, Rafa. My question for you, Rafa, would be: you mentioned a wide range of solutions, cash transfers, fortification, minimum wages, and so on, and I agree with all of these. And obviously, their design and implementation will be context specific, but their potential, as you said, is pretty much universal, showing exactly what we can learn across country contexts. But my question is, from this menu of options, did you get any sense from reading all these papers on how to go about deciding on the appropriate bundle or combination of those options for each context? The bundles will differ, but do we know enough yet on how to decide on what that bundle should look like? Just one final word, from a USAID perspective, we recently launched something called the Accelerator Initiative across 3 countries in Southern and Eastern Africa, Malawi, Tanzania, and Zambia. And the idea is that we know a lot about solutions in each of those countries, for each of those countries. But the idea is to apply a more regional cross-border perspective to some of the solutions, focusing on border barriers to trade, how food trade, more attention to food trade can enhance investments in cold chain, enhance storage, all of which can make access to diverse diets more affordable, more accessible, can reduce food loss and waste, increase demand for nutrient-rich foods, all of these things. And this matters by taking a regional lens. It's not just about the Lobito corridor connecting Africa from east to west as a transportation corridor. It's also about what goes alongside, what parallels those transportation corridors that can enhance diets, not just incomes, when you start moving food across countries. So that's just one example of how USAID is thinking about what is most appropriate in countries, but also across borders, and trying to find regional solutions and clusters of solutions across borders that make sense. I will stop there and hand over to Bill Dietz, and look forward to your comments, Rafa and Amos.
Well, thank you, Patrick. It's a great pleasure to be here. And full disclosure, I have a paper in the supplement as well. And I'm going to depart from what you've heard up to this point. The focus has been on immediate kinds of strategies. And that's certainly easier than talking about the more urgent issue in my mind, which is climate change. And that the biggest threat to food security globally is climate change. And there are two examples of that. One is that climate-related such as fires, droughts, floods, hurricanes are a consequence of global warming and climate change. For each degree increase in global temperature, there's a 7% increase in water vapor. And we see examples of that in the warming of the Pacific, which led to the atmospheric rivers that dumped tons of water on the West Coast. And more recently, the warming of the Great Lakes led to the kind of weather bands that dumped snow on Buffalo and points east. And ultimately, these have implications for the access to food and food production. And the most recent example of that is the effects on fisheries in California and the effects on wildlife. We have a special responsibility related to global warming. We're second only to China in terms of greenhouse gas generation, and fourth in the world on a per capita basis, the other two being India and China and Brazil. In the US, 30% of our fossil fuels come from transportation, but only 15% of that is for car use. 10% of our greenhouse gases come from the agricultural sector, particularly beef production, and half of that 10% comes from the methane released by cattle. And methane, just to remind you, is 80 times more powerful than CO2. And advantageously, it also has a very relatively short half-life, so we need to focus on that. But it's not widely understood that the other half of the agri-food sector contribution to climate change comes from the production of fodder, soy and corn. And the agricultural sector there depends on fertilizer. And a lot of the fertilizer is not absorbed. It is washed into the river, the Mississippi, for example, and contributes to the Gulf dead zone. And furthermore, is converted to nitrous oxide, which is 300 times more powerful than CO2. And just to give you an idea of just how powerful that is, cows generate almost 100 kilograms of CO2 equivalent per kilo of beef. A comparable amount in chicken is 10 kilos for 1 kilogram of chicken, and 0.8 kilograms of CO2 for a kilogram of soybeans. So it's, in my mind, if our major contribution is from the beef system, and interestingly enough, that's gotten less attention than the whole area about the fuel. And in my view, the electrification of cars and the reliance on sustainable production of energy. I think that in that context, the reductions, and the important word here is reductions in beef consumption, may be more malleable than any changes in fossil fuel because of the electrification of cars. Now, the politics of this are substantial. You may remember that during the COVID outbreak, when the chicken processing plants were suffering because of the illness of workers and deaths of workers, President Trump at that point declared a national emergency around beef consumption. That beef consumption, chicken production was part of the critical infrastructure, and released an executive order that mandated that these plants stay open. The other thing is that in the Dietary Guidelines Advisory Committee recommendations in 2020, the recommendation was a reduction in beef consumption for more sustainable agriculture and more sustainable food supply. And both the Secretary of HHS and the Secretary of USDA said that the sustainability is not a criterion for food. So we're up against some very powerful opposition when we come to talking about beef consumption. I just gave you the national level, but the arguments around meat consumption are that it's natural, that it's necessary, that it's normal, it's nice, it tastes good. But I would remind you that we consume 3 times as much beef as we need to, whereas the developing world, which really needs more beef because of its micronutrient content, like iron, like zinc, like B12, and protein, that the developing world really needs more of that. But we here need to focus on to change that. And I think given the split in Congress and the fact that beef production is largely limited to red states, that we need to focus on what we can personally change and engage families, peers, and organizational networks to build political will. And that means changing our institutions at the institutional, municipal, state, and federal levels. And to begin to change the defaults in global food purchasing, particularly in our agencies as well, and other practices. So the bottom line is the emphasis on what we can do, as you've heard from the earlier talks, is essential. But unless we come to terms with climate change, those efforts will be for naught. Thanks.
Thank you, Bill. And let me turn it over to Dr. Cecilia Tamari.
Thank you. And obviously, both previous speakers have addressed several really key points, and we've seen a lot of cross-cutting issues across the entire supplement and the introduction. So we've seen the intersection of broader inequities and the ways that we can conceptualize this across the social ecological model, and thinking about structural solutions, which are some of the key points I think everybody has emphasized. And also we've seen an emphasis on life course approaches, which I think is a key issue. And of course, I also have an article in the supplement. So I am going to talk a little bit about why it's important to think about that across dimensions. So I wanted to also highlight how important it is to deal with some of these complex factors across issues that we're dealing with that are bigger than any single factor, and obviously cross-border. So Bill talked a lot about the cross-cutting issues around climate change, and I'll talk about that a little bit more, but also wanted to mention other major threats to food security that often happen at the same time. So we are dealing with the rising, accelerating impacts of climate change at the same time as we're also dealing with the threats of pandemics that we have seen and that are likely to occur again, which have major disruptions on some of those basic issues that we're dealing with, like being able to access resources, being able to go to work, stay safe, and feed a family. These are major issues that we're all dealing with across borders. we're also dealing with the rise of conflict, and we haven't really talked about that, but I wanted to mention that conflict is, of course, one of the major drivers of food insecurity globally. And in the cases that I looked at, and of course, I highlighted some of them, but we are watching that unfold, and conflict can have many different percolations, both in the conflict zone, but in other regions as well. For example, impacting access to whatever source of food that may be exported from a particular area that is in conflict, or rising costs of fertilizers because of conflict, or other kinds of concerns. So those intersecting factors I wanted to highlight. And let me give one example of some of these and how they kind of intersect with the last point that I wanted to raise, which is some cross-cutting influences in the policies and the regulatory space around these issues that actually cross-cut both issues around climate change as well as ultra-processed food, and of course, enabling environments for breastfeeding, and that has to do with marketing and the cross-cutting issues around the tactics that are deployed by corporations in sort of the fashion of merchants of doubt and other tactics that we have documented that systematically undermine policy action. So those are sort of the big picture issues I wanted to highlight, and I think I have maybe 30 seconds for an example of how they can come together. So when we have issues like the accelerating impacts of climate change that Bill just talked about, we can have situations where people do not have access to safe water, and yet may also be structurally in a place where they may not have had adequate breastfeeding support either. And in those spaces, sometimes because of the way that we conceptualize these things as separate, as emergency preparedness versus food security versus whatever else people are responding to, we sometimes have people falling in the middle, and those are some of the most vulnerable people. So infants and young children who may not be exclusively breastfeeding and are relying on all sorts of feeding methods that may be completely unsafe in these circumstances, are left completely vulnerable and right in the middle of all of this. And if we add, a pandemic, which has happened at the same time, if we add conflicts, and if we have, rhetorics where the solution to these issues is actually, so-called helpful donations of formula, for instance, that actually lead to more deaths. So it's an example of sort of how multiple factors can come together, leaving people vulnerable, and those who are already at a structural disadvantage even more vulnerable. So I wanted to end with that and then turn it over to questions.
Thanks so much. And actually, I think what you've just talked about actually kind of sidelines into a couple of the questions we got in the chat around another factor that also is influencing around sort of the inequities around gender. And I wonder if you all could, if a couple of you could sort of say, sort of reflecting, I think, both on what Cecilia has just said and also including that aspect as well.
Did you want me to take that one, Susan? Was that for me, or what? I wasn't sure.
Yeah, sure. Why don't
Sure.
you? And I saw that Rafa also unmuted.
Okay, great. So very briefly, I think you can't untangle gender politics from any of this and gender inequities. And I think one area that we also want to pay attention to is that gender inequities can also be weaponized by some of those rhetorics that I talked about. So in the enabling breastfeeding environments, for example, we have gender politics and gender inequity being highlighted as a marketing opportunity rather than, of course, addressing the underlying structural issues. So that's just one other way in which we have intersecting structural determinants.
Yeah, just what I wanted to add is that globally, no matter where women are much more likely to be food insecure than men, that globally, no matter where the conflict is, women and children are usually the ones left behind and that face the most severe forms, experience the most severe forms of food and nutrition insecurity. And that, based on research I have been doing with colleagues in Brazil, it is also super important to use an intersectionality approach because it's not only gender, but when you cross gender, with black skin color, with poverty, and so on. Instead of the effect being additive, it becomes multiplicative in terms of the risk of experiencing food and nutrition insecurity. So unfortunately, it's not only one, but multiple inequity dimensions that need to be addressed simultaneously to address the food and nutrition insecurity endemic.
And exactly, and Rafa, I like the way you put it right earlier on that you refer to them as cultural determinants of, the food insecurity, food security we are talking about here. And I totally agree with both of you. It is not peculiar to any region of the world. So globally, cultural norms, shape labor, division of labor, food production, food consumption patterns. In some settings, even intra-household, food distribution dynamics, as Rafa noted earlier. There are times when certain sexes are prioritized. If we look at the implement or equipment that we use in our food systems, and people have argued as to how that is so gendered. And I can give an example of, accidents that happened in some part of northern Ghana where I visited. And those accidents happened, why? Because a woman was operating a tractor. People felt tractors are meant for men. And here we had a woman, challenging the orthodoxy, has learned how to operate it and was operating. And the accident was never caused by the woman who was operating it, but onlookers and drivers who felt that was just out of, place. So yeah, gender issues are widespread in the space that we find ourselves in.
Yes, and the supplement does include a beautiful paper on women's agency, which is absolutely crucial. And by the way, in terms of Patrick's very, very thoughtful comment, yes, the paper on the definitions and constructs fully address agency and sustainability as a key dimension related to food security. But more importantly, it really takes us a step further into food sovereignty in terms of people having the produce distribution and consumption of food controlled by them. They control their food systems, their food policies, and so on. And that cannot happen without agency and sustainability. And also Brazil, for example, added the dimension of human rights to their definition of food security. This is not only a public health issue, it is very much so, if not more, a human rights issue as well. And research that we have done in Brazil really has identified the cultural dimension, in the sense among indigenous groups, the foods that they communicate to us connect them with their ancestors. And it's a difficult one to deal with because they're not necessarily very nutritious foods always, but in their cosmovision, very much that connection with their ancestors, their ancestral foods, are a part of their conception of what food security is. So lots of more work is needed conceptually in this field. Totally agree.
We have just a couple minutes left. Maybe what we could do is, could we just go around and you can just give a very quick sentence about what you think right now the research field needs to do next? I think it would be a great way to sort of wrap this up. So maybe I'll start with Bill.
I think we have to come up with practical solutions to the effects of climate change on crops. So we know that increased global temperatures reduce crop yields and reduce the content of micronutrients. So this is a slow-moving form of food insecurity, but one which I think technology can improve.
Great, thanks. Amos.
I would use these few seconds to respond to Patrick's question that I didn't have an opportunity to do. And so Patrick, in relation to what Susan is requesting, I think what researchers, especially within the food environment space, to focus on doing is not looking forward to a global definition of food environment that has consensus across geographies and across practitioners. We're looking forward to having, fit for local purpose conceptualization of the concept that then allows ease of operationalization in those settings. And so I'm aware of researchers who are working on coming out with, 2.0 of their framework of food environment, where they are going to be looking at how can we present it in such a way it's useful to policymakers, to college researchers, to practitioners. I think that's where we should be headed towards. Thank you.
Thanks. Patrick.
Just one? Okay. If it has to be just one, it sounds boring, but it's the business model. We need a clear articulation of costs, benefits, and economic trade-offs for all our solutions and bundles of solutions, because without that, we'll never get the ministers of finance, the prime minister's offices to take our kinds of suggestions seriously at the intersection between human and planetary health through food systems and diets. We have to cost it out. We have to make credible business models available and emphasize those whenever we can.
Great, thank you. Cecilia.
Two interconnected into one. Working across silos, I think, is what we really need to be able to address the complexity that we need to have. And I think we need to become much more familiar with the commercial determinants of health to be able to achieve the policy goals that we want to achieve.
Great, thank you. And Rafa.
Yeah, dramatically, and I mean dramatically, transforming food systems, water systems, and healthcare systems, and strengthen the link among them. This will not happen unless we have sustainability across all of these systems in place, and that we really, really seriously address the enormous structural barriers that are the legacy of the colonial neoliberal systems that continue to determine how the vast majority of the people access their basic human rights that they have.
Great, thank you. That's great. And I would say for myself, I think these sorts of opportunities to really have more of this sort of mutual learning and thinking about how we do this kind of adaptation and translation more, I think is something that we absolutely need for the field. So let me just thank all of our speakers today. This was absolutely wonderful. It was really captivating, and I'm so excited that we have this. This has been recorded. When it's ready, it will be put up on our website in case you want to listen again. I know I did not capture half the notes I wanted to, so I will be listening. But I just want to say thank you to all of you, especially to Amos and Rafa, who have been such great partners on this. Definitely couldn't have done it without you. So thank you, everyone, and hope you have a great rest of your day.